For over 60 years, the ARC Alliance has been in your community, providing support and services for families and individuals with special needs. From birth through life, the ARC Alliance team of experts and specialists are here to find solutions to your needs.
For years, we felt alone as we take care of our son. The ARC Alliance support team brings compassion and understanding to our family and provides hands-on solutions.
The ARC Alliance, we're here to help you today. For more information, call 610-265-4700 or visit thearcalliance.org.
Hi, I'm Wendy Stimson, the Executive Director of the ARC Alliance Children's Services, and I am here today with...
I'm Nicole. I'm the Director of Medical Assistance Policy for the Office of Income Maintenance for the Department of Human Services.
And I'm Staci Kenney. I am an Early Intervention Advisor with the Bureau of Early Intervention and Family Supports through the Office of Child Development and Early Learning. And we're here today to talk a little bit about medical assistance and what all is involved in that. So it's a pretty broad subject, but we'll start very generally. What is medical assistance?
Medical assistance is healthcare coverage for eligible individuals. It is administered through the state in Pennsylvania. It's a joint program where it's a jointly funded program through the state and federal government, and the state administers it through federal guidelines. It's for eligible children, low-income families, seniors, individuals with disabilities.
So if you have early intervention or a child in early intervention, which would cover a child birth to 5, how do you find out if your child is one of those that would qualify for medical assistance? So your service coordinator in early intervention or even your service provider could help you to navigate the process. They can give you the information you need to get you started. There is a website called Compass where families can go and fill out the application for medical assistance and also for other services. But we would highly encourage asking your early intervention service coordinator or your early intervention service provider if you would like more information, and they can help get you started. What types of disabilities would qualify you for medical assistance?
For children, it's a wide range of disabilities. When you apply for medical assistance, if you have an early intervention evaluation, you would want to include that in the application so that the caseworkers at the county assistance offices know to review you for every category of medical assistance that we have. And then what happens is if a child has a disability, we can open them either in a regular MA category or in our presumptive eligibility for children with special needs category. And then they get reviewed through a process to determine, to certify their disability either through our MRT, medical review team, or Social Security.
So how does medical assistance pair with your primary insurance if you have a primary insurance?
Medical assistance is the secondary coverage, so it covers things that your primary or private insurance wouldn't cover.
Do you have a card that you would carry, so you would hand both cards in and the doctor takes care of that?
Yes, you would get what we call an access card for medical assistance, and you would provide that at the doctor's office. And also when you apply, you choose a managed care organization, so you would get a card from them as well.
So many of our families have children that spend a lot of their time, their first days in the NICU, and just accumulates a lot of expenses. How can these medical bills be helped with medical assistance?
So either the hospital will apply while the child's in the NICU, or the parents can apply, and we can go back 3 months retro from the date of application for the parents, the date of application from your date of first admission in the hospital, You would want to provide those medical bills along with your application so that if they're needed to spend down or reduce your income, they would have them available to use that process to determine the eligibility.
I would also like to mention for children who have a NICU stay, they are eligible in early intervention for at-risk tracking through the early intervention infant toddler program, and that is where the intervention program will screen the children and just determine if developmentally they're on the right track, and they do that within a certain amount of months every so often, and they can do that if needed up until the child turns 3 years old.
Very nice. Is there a time limit as far as age goes to apply for medical assistance if your child has a disability?
No, there's no time limit. I mean, children with disabilities in our children with special needs category, that goes up through age 18. So you are, I guess, limited at that point, but that doesn't mean that they may not be eligible for other assistance after age 18.
Nice. So I've heard medical assistance used in conjunction with terms like access and WIC. Can you explain the difference between them and how they're interrelated? If I have one, do I get all three?
Okay. They're all income-based programs, and medical assistance is based on income guidelines and non-financial eligibility rules. WIC is actually run by the Department of Health, so it's outside of the Department of Human Services, but it's also an income-based program with other non-financial eligibility rules. Being eligible for one doesn't necessarily make you eligible for the other because they're income-based and they're run by different guidelines and different eligibility rules. The access that you mentioned is what we refer to as access is the access card, which is the medical assistance card. But there's other programs like SNAP and TANF cash assistance for families. And with that, you would get an EBT card to help cover things that cash would need to cover, or SNAP for food necessities. Again, being eligible for medical assistance doesn't necessarily make you eligible for those programs because they have different income guidelines. They're run under different umbrellas of the federal government.
So if I have medical assistance and I need things such as a specialized formula or diapers, does that help with those expenses?
In certain cases, depending on the child's diagnosis, age, things like that can be covered if they're prescribed by a doctor. Some over-the-counter things are covered if they're prescribed by a doctor. The best thing to do if you have any questions about what's actually covered for your child and their particular situation is to contact your managed care organization, which would be your healthcare card, to ask those questions to be sure that if it's covered or not.
Right. What about behavioral health? If I have a child that needs services such as wraparound services, do I have to have a medical assistance card in order to receive behavioral health services?
Some private insurances will cover wraparound services, but not all of them do. So you can apply for the medical assistance coverage to get those wraparound services. And again, it's another one of those instances where if you're reviewed for the regular categories of assistance and you're not eligible due to household income, if you have an IEP or evaluation that says you have these needs, we can review you for the children with special needs category.
Very nice. Have you, what kind of benefits have you seen with the families that you work with for medical assistance? Have you seen the benefits of having it with them?
Yes, so there's lots of different programs where you can get reduced priced tickets or admission to community events, and there's actually a listing of those on our website that I'm going to give you. It's papromiseforchildren.com/community-inclusion. And that has a whole list of different events where if you have medical assistance, you can get reduced admission to museums or different community events. There's also reduced or free admission to national parks as well.
That sounds like a perk to apply for. How do I apply?
So there's there's multiple different ways you can apply. Like she mentioned earlier, our Compass website, that's what we like to promote the most because it's the most convenient, it's the easiest. You can apply for multiple benefits on the Compass website. It allows you to go in and start the application. If you need to step away, you can come back to it at another time. You can also apply by phone, and I can give that phone number. It's our Consumer Service Center number, and that is 1-866-550-4355, and somebody will assist you through the application process there. You can download an application on the dhs.pa.gov website. You can call our Customer Service Center number to have an application mailed to you. You can go to a CAO and get an application and apply in person. But we really like to promote the Compass application as the most convenient and easiest way to apply.
Sounds like you have all your bases covered.
Yes.
Do they have, if you are not a primary English speaker, do you have help for those that speak a different language?
Yes, the Compass website itself is also in Spanish. You can go through that way. There's assistance through when you call in. We use language assisters to help with that.
Nice. What would I need if I sit down at my computer, pull up the Compass website? What should I have handy that I will need to fill that application out?
Your household members' information, name, birth dates, social security numbers for those that you're applying for. Any income that's, the parental income, any income that the child may have.
How would the child have income?
The child can have income through Social Security. They may be receiving SSI or RSCI benefits either because of disability or because of the loss of a parent who may have income. There are children who are making a lot of money on YouTube. That's an example. So there are ways for children to have earned income. In most cases, the children will have some type of disability income that they're looking at. So the Compass application, the paper application, walks you through everything. And if you don't have everything at the time that you apply, you don't need to have it then. Compass will give you a general list at the end of things you may need to provide verification for. But you're also going to get a letter from the CAO that says this is what you need to finish your application. And some incomes and some things can be verified through electronic data sources, and you may not even have to provide verification for that.
So I've heard you reference the CAO. What does that stand for?
It's our county assistance office, and each county has one that individuals can go to or contact, and that's where the applications are processed. Or if you have to. There's no interview needed for a medical assistance application, but if you do apply for SNAP or TANF cash assistance, an interview would be needed where you may have to go for cash, for face-to-face interview.
Okay. So if I apply, how long does it take usually to hear back?
So if you apply online through our Compass application process, there is the opportunity for what we call real-time eligibility. So if you apply today, you may be eligible by tomorrow. In other cases, the process is going to take up to 30 days to complete. And that's because you apply, the application goes to the county assistance office, they review what they need, they're going to send you a letter, then they're going to give you time to collect the information for you to be able to send it back, or upload that information through our Compass website or our My Compass PA mobile app. So that's another easy process that we have for being able to get your information to the CAO. So 30 days is the time frame that we have to process an application within. Sometimes it can go a little bit past, but that's usually because we are working with you to help get you information. It may be a little difficult if you're working with a doctor. It may take a little bit longer to get information, so we can give up to 45 days. But it's usually within that 30-day time frame.
So if my child is in early intervention, other than my evaluation that I've gotten from my eval team, will I need any documentation from doctors to apply for medical assistance?
Sometimes you may need to get a what we call a disability assessment form completed from a doctor, which will list if it's a long-term disability that's going to last, more than 12 months or things like that. There may be requests from our medical review team to say we might need a little bit more medical documentation than what was already provided, and they'll help you find out what that is.
Perfect. So if I have medical assistance for my children or myself, are there other opportunities that are open for us by having medical assistance?
So there's other income-based programs that you may be eligible for because you're eligible for medical assistance. One of the things for children is that if you're eligible for medical assistance or if they're open on SNAP, you get referred for the National School Lunch Program, or you may be eligible for free or reduced price school lunches. So we work with the Department of Education on that to make sure that children who are eligible for it and families who are eligible for it are receiving that benefit, which can really be a help day to day. Another thing that families may be eligible for is lifeline telephone assistance. With your eligibility notice, when you get determined eligible for medical assistance, you'll get a flyer in there that tells you a little bit about Lifeline. It's a discount towards either a landline phone or a cell phone. And you can get more information on that on fcc.gov or the puc.gov, which is the Pennsylvania Utility Commission. So it's really a benefit to families who are income eligible for programs that they get these other benefits as well.
Nice. So if my child has early intervention and I want someone to hold my hand through the process, who can I call?
If you receive services through the infant toddler program, you can work with your service coordinator, and they are very knowledgeable about the process of applying for medical assistance, and they can help you. If you receive services for preschool early intervention, you may or may not have a service coordinator you work regularly with. It varies by early intervention program, but you can talk to your early intervention service providers, whether it be a teacher or a speech therapist or whatever service you receive, and they should also be knowledgeable to guide you in the right direction.
Great. And if I don't have a service coordinator, or if I'm not in early intervention, who can I reach out to?
I would recommend calling our customer service center, and that's 877-395-8930, and they can direct you to how to apply, or you can contact your county assistance office, which there's a list of those on the dhs.pa.gov website. You can just, apply, and your caseworker will be in touch with you. Sometimes the best process is to just apply to see if you're eligible and get that process started so that you have the support set up for your family that you need.
Is there any words of encouragement you would want to offer our families as far as getting medical assistance?
I would say to definitely apply. It can make a real difference in covering, even if you have other insurance, it can make a real difference in helping to cover co-pays and co-insurance and deductibles and stuff like that. It can really help. Also with early intervention, medical assistance can help early intervention support all the children that may be in need of services.
Very nice, thank you. Any last words of?
It's like I said, it's a support that's there for your family, and if you are eligible for it, you should feel comfortable taking advantage of it and using the services that are there to help you and your children thrive. And that's what medical assistance is there for, is to make sure that the children are getting the services that they need so that they can thrive and get the support that they need.
Wonderful. I thank you very much for both of you coming today and giving us your wealth of knowledge and sharing that. And we do encourage you to apply for medical assistance. Thank you.